So I'm very excited. Before we break for lunch, as I hope you've sort of taken away from our discussions today, we are incredibly sort of committed to partnership in our work. We recognize the leadership of organizations and the importance of those partnerships. We also have discussed, I think, throughout all of the panels, the importance of the humans, the courage of every individual, whether it's the bedside nurse, whether it's the CEO of a Fortune 10 company, or whether it's the innovators who have had an experience with their own family, who recognize, know that we need to drive forward and we need to sort of act, behave, innovate in different ways. And so we are going to be presenting our inaugural DiMe Impact Innovator Award. Before we do that, I want to introduce my colleague, Dr. Ryan Vega. Ryan is the Chief Clinical Officer at Vantiq. He's also our physician in residence. So we have clinicians on staff. I've got my colleagues Smith and Jake somewhere in the room. But we want to make sure, just as Grace helps lead us in making sure we keep the patient in mind, we never stop thinking about the physician. So Ryan, I'm going to ask you to introduce yourself, then I'm going to recognize our nominees before Ryan makes the award.
Thank you, Jen. I'll keep this brief. Jen's only instructions were me to not have an Oscar moment, but I am a practicing physician, spent about a decade in the Department of Veterans Affairs, where I first got introduced to DiMe, and was both captivated by the importance of their work, but also how necessary Jen and her team's leadership are to American healthcare. A big part of the reason I was able to find time to join is because I believe in the mission. And now I sit in sort of a role where I lead healthcare tech for a startup company that focuses on AI orchestration across the globe.
And we are doing a little bit of the back and forth in the shared microphone, but you know, we'll try and keep the jokes down. And this is serious stuff. So first of all, I want to recognize Juan Espinoza. Juan, you are not only one of the smartest people that I've had the privilege to work with, you also are absolutely a card-carrying member of the Get Shit Done Club. You have sort of more energy, more ambition than many of the innovators I've had the privilege of working with. Just a few highlights. You founded the Consortium for Tech Innovation for Pediatrics. You think tirelessly about the needs of children that are underserved in healthcare generally. But when we think about how we're developing new innovative solutions, oftentimes, far too often, we overlook the most vulnerable members of our society. The patients who need us the most are children, but you don't. You champion them every day. You've also done tremendous work by leading consortia such as iCode, figuring out the standards we need to get CGM data into the EHR, for example. And you've been a tremendous partner to us in all of our work on pediatric innovation, and most recently in pediatric rare disease. And I can think of no, I think, better endeavor for us to partner and for us to capitalize on sort of your leadership. And so, Juan, congratulations on being nominated, and thank you so much. Stand up. I'd also like to recognize Chisan Sarabu, who is relentlessly dedicated to equity and transparency across the entire data lifecycle. I think that you are probably the person who's taught me the most about how we connect the dots between technology and clinicians. One of the heroes of our story that we need to be supporting, and too often we sort of fail to connect those dots. You teach me a lot, and I know that every single one of our team here at DiMe who've had the privilege to work with you have learned from you, and I'm inspired by your courage and your sort of relentless focus, equity, and connecting those dots. You are making us better, and we are releasing our playbook on healthcare AI implementation next month, and we couldn't have produced the quality of resource that we're going to be launching without your support. So just thank you for everything you do every day, and congratulations. Nasha was not able to join us today, but I want to make sure that we recognize her too. She is a tireless advocate and a change maker for pediatric rare diseases. Not only does she lead Citizen Health, where she supports patients through patient-centered health record integration, the development of AI solutions to really support patients navigating the system, and also the development of rare disease registries. She's also the mother of a child with rare diseases. She founded the FOXG1 Research Foundation, and she works tirelessly every day at the very forefront and to sort of transform how we care for the most vulnerable patients, and has the attitude that when we get it right in rare diseases, we can do it anywhere. So Nasha, hopefully you're listening in. Thank you for all of your hard work. Thank you for your partnership to our efforts at DiMe, and congratulations. Howard is also not able to join us today, and this is public, so I'm comfortable saying it. He's currently fighting his own battle with multiple myeloma, but Howard is no stranger to hard work. Howard founded Tidepool and has fundamentally transformed the experience of patients with type 1 diabetes. He's forged brave strategies. A lot of the software products that he developed really pioneered new regulatory approaches for software products. And he took a very different approach to traditional sort of software as a medical device development. And Tidepool is actually a nonprofit. So he bootstrapped the whole thing. He worked tirelessly. He never took his focus off patients. And Tidepool is, I think, one of the best-in-class examples that we have of extraordinary innovation in our field. So Howard, again, I hope that you're listening in as we celebrate you. We're wishing you all the best. We're standing with you, and congratulations and thank you for all that you've done. And then last but absolutely not least, John Bloom, who is the founder of Podometrics. So John, I did a little bit of history on this. So learned that you founded Podi when you were still a student at MIT, and that one of the things that you and I discussed during a conversation, it was actually quite recently, I think just a few months ago, was, you know, the experience that you had founding a company that was VC funded, where you wanted first and foremost to take the technology to work first for veterans. And the pushback that you got, because the timeline would be too long, and the fact that you took an even harder path than the already difficult path that we experience in innovation to make that work. And whenever anyone asks me at a conference, what's the greatest example you have of digital health innovation that works, I always talk about Podometrics. So it's a FDA-cleared smart mat that's coupled with sort of comprehensive wraparound clinical services. And I say this as the wife of a spouse who's in the military, and I think about sort of our future, his future. We have a prevalence of diabetes in the veteran population that's higher than the rest of the population. We, fortunately, because warfare is changing, are able to welcome veterans home from the theater of war, largely with their limbs intact. But then we lose them because we can't manage their diabetes correctly. And John, what you've done, and Ryan, you'll correct me if I'm misspeaking, we've reduced, through the use of your solution, the number of lower limb amputations in veterans by 75%. So congratulations, thank you. So Juan, Chitan, Nasha, Howard, John, you are exceptional. You inspire us every day. You are the best of what we sort of need to step up and deliver on as a community in order to be successful in pursuit of our goals for Healthcare 2030, in order to create a sustainable, compassionate, patient-centric system that cares for people. So with that, Ryan, I'm going to hand it over to you to announce our winner.
Thank you, Jen, and congratulations to all the nominees. There's probably no truer statement that healthcare is hard. And for most of us, and I suspect everyone in this room, we're driven by a why, a much larger vision of what we will leave behind. And this year's recipient, I have both some personal connection to, having watched both their struggles, having seen all of their successes, but deeply felt connected to their why, the founder's story, and the impact that they're had. Without further ado, this year's recipient is John Bloom with Podometrics.
Excellent. John, I'm going to ask you to give a few remarks. I know you weren't prepared for this. So as long or as short as, well, maybe not as long as you like, of an appropriate length.
Is it 20 minutes, right? That's right. 20 minutes?
Yes.
I did not expect to get this award. Some amazing, ferocious entrepreneurs and just companies that we got to share the stage with. Yeah, this was never a sexy problem, fighting amputation reduction, especially when, if you're successful, you drop hospitalizations, you drop surgery counts, and the healthcare system doesn't necessarily know how to consume that, right? So how do you create something that saves a lot of money and then get it into homes? And it's been 14 years to get here, but it's been exciting to get to see now we're in every state except for Alaska and driving really good outcomes. But of course, I deserve very little of this. I have a phenomenal team that's been able to get us here. They pushed me to be better, stronger, and just appreciate all of you and all the work we've been doing broadly on driving better patient care. Thank you for letting me have this award.